Hi, this is Dr. Stephen Katz, owner of the alternative medical clinic based in Scottsdale, Arizona called Naturopathic Physicians Group. I co-host the show Your Health is Wealth. I hope you enjoy this informative natural medicine podcast and listen weekly for the newest installment. You can learn more about us at naturopathicgroup.com.
Welcome to Your Health is Wealth, giving you the keys to unlocking better health naturally. Today you'll learn about how to bank wisdom for a richer, fuller life. Your hosts are Dr. Stephen Katz, an award-winning naturopathic physician and former president of the Arizona Naturopathic Medical Association. Dr. Loreena Ryder, a naturopathic physician and current board member of the Arizona Naturopathic Medical Association.
Welcome to this week's episode of Your Health is Wealth. I'm your host, Dr. Stephen Katz, alongside with my co-host today, Dr. Loreena Ryder. We're here to help you navigate your journey to wellness. We like to do it simply without all of that horrible medical terminology. We're here to help provide practical solutions to your health issues that allows your body's healing systems to do the work for you. It's simple, it's natural, and it works. If you're still struggling with your health, come see us at Naturopathic Physicians Group to help get your life back.
Hi, Dr. Loreena Ryder here. So what is a naturopathic doctor? A lot of times naturopathic doctors are the last stop for those who've been to many other doctors searching for answers to their ailments. We provide specialized or primary care. At Naturopathic Physicians Group, we spend an entire hour with you during your first appointment. We do a thorough intake to determine the root cause of your issues. Naturopathic doctors focus on prevention of disease and using your body's own healing abilities.
Every week we like to do a different topic, and as I say every week, this week is no exception. This week we are going to talk about dizziness and vertigo.
Yeah, some symptoms you might, it's pretty self-explanatory, right? Dizziness.
Are you dizzy?
Not at the moment.
Well, that's good, because then we can put on the show.
So yeah, dizziness and vertigo mean the same thing pretty much. It's a loss of balance or even falling. You may experience some eye focus difficulty. Oddly enough, you may even experience some hearing loss, and that can be in just one ear or both ears.
Unchosen hearing loss. You want to make sure that it's not that you're just ignoring the person talking to you. It's actual hearing loss when you're trying to hear.
Yeah, so this excludes selective hearing loss.
What'd you just say?
That, exactly.
Oh, okay, get it.
Also, tinnitus, ringing in the ears, some nausea and vomiting you might even experience if you have vertigo, and sweating.
Allergies, mucus, infections. There's so many different causes on there. But to go through common ones and ones people don't always know about, one of the common ones is anemia. And anemia is low red blood cell production. There's a lot of causes of that, but iron deficient anemia is one that definitely can cause dizziness and fainting. You need iron to produce all of your red blood cells. So you don't have enough iron, you make less red blood cells, hence the anemia. But red blood cells carry your oxygen, so less oxygen gets outputted to the rest of your body, including your brain, which can lead to dizziness and fainting.
Right, exactly. Also, orthostatic hypotension, not hypotension, which means the opposite of hypertension. This is low blood pressure, and this is low blood pressure upon standing, which can produce dizziness. You can even fall or pass out due to low blood pressure. This can be dangerous at times.
Po rhymes with low.
Yes, it does.
I'm all about rhyming because it makes things easier. I had so many mnemonics in med school. It got me some word pretty dirty too, but it still gets you through.
Those are the ones you remember for sure.
I still remember most of those. I can't remember the ones that weren't dirty. Unfortunately, that's the truth. But structural misalignment, this is a very common cause of dizziness and vertigo. If you have a misalignment in your neck, this is where chiropractors make a lot of their money. This is where a lot of treatments, orthopedic doctors, PT doctors make a lot of their money. If you have a misalignment in your neck, it can cause nerve issues and lead to vertigo and dizziness. This can happen from car accidents, stress and tension. We all hold our tension in our neck. We've all said that before. Bad posture. Get off your phones. Not saying get off your phones completely, but if you're looking down on your phone the whole entire time, then you are going to cause yourself some major neck issues.
If your back and head look like the letter C, and that's bad posture when it comes to looking at your phone.
And I don't remember the exact weight, but they said every 10 degrees you move your neck forward, you like increase the amount of weight you're putting down on your neck.
Right. Totally. I think it's like the average head is 8 pounds, and whenever you go 20 degrees down, it like adds another 10 or 12 pounds. I can't remember exactly, but yeah.
So average is 8 pounds. So I'm like 10, 11. Got to carry that brain in there.
Right.
But basically bad posture, bad sleeping position, all of that stuff is going to lead to potential dizziness, vertigo, etc.
Mm-hmm. Yeah, hypoglycemia is another condition that you should rule out to make sure that it's not a problem and causing the dizziness. And this is low glucose or low blood sugar in the body.
PO is low.
It is. PO is low. And it's typically from just not eating regularly. Oh, I forgot to eat until 3 p.m. or something, which I never have that problem, but some people do.
Yeah, you usually have to train your body if you're going to skip meals. We don't always say do that, but you have to train your body to that. Otherwise, the blood sugar and the insulin our body produces to lower the blood sugar doesn't know what to do. So if you're not eating, there's not enough blood sugar there, it's going to cause that dizziness.
Mm-hmm. But you also need to take a look at it as a physician and make sure it's not a more serious condition like diabetes.
Correct, because one of the other big causes of dizziness is going to be medications. Blood pressure meds, if you drop your blood pressure too low, you can get that dizziness. Blood sugar meds, if you're trying to play the diabetic game and you lower your blood sugar too low from that, you can get your dizziness.
Right. Also, if you have vision problems, like you need to get to the eye doctor, you haven't been there for a while and you're just not seeing properly, that can appear as dizziness, because if you're not seeing properly, your body doesn't know where to put its feet and hands and placement and all of that.
And some of the worst causes of this are going to be if you have a stroke, cardiovascular events, or if you have a brain tumor. If you go on Google and look up dizziness, you're going to tell you have a brain tumor and you're going to freak out. Don't do that. We tell everybody not to do that because Google Docs can be dangerous and they never tell you it's something mild. You go in there and write fatigue, oh, you've got cancer. You go in there and say you have numbness or tingling, oh, you've got MS. Like, it's really ridiculous on how scary those things show up. Mm-hmm. But stroke, brain tumors are kind of the worst case scenario things that can be causing it. And the most common probably in the world,
dehydration. I mean, we talk about water and diet all the time, but dehydration is the number one cause of dizziness. It's just, I don't think people really realize how fast our bodies go through water and we just don't replenish it. And we end up having brain fog and trouble going to the bathroom and just lots and lots of things happening. So, half of your ideal body weight in ounces is going to be the ideal amount of water. Now, that's not counting if you have physical exercise where you're sweating a lot, if you have coffee that's a diuretic that's, taking the water right out of your system, and also alcohol consumption.
Yep, and migraine headaches is another common cause of dizziness. But of course, that's not usually the cause of it. You have to find out what caused the migraine, which we've talked about before. There's a lot of potential causes on that. But basically, if you suffer from dizziness and vertigo, you've got to figure out what's triggering it. Otherwise, it can last for years and years and be a major problem.
Right. Thanks for tuning into Your Health is Wealth. We are the doctors from Naturopathic Physicians Group located in Scottsdale, Arizona. Today's topic is vertigo.
Every week I do a segment called What Isn't Your Doctor Telling You? This is not an anti-doctor segment. This is just when you have your very short meeting with your doctor and you ask them 100 questions and they tell you they have time for 2. There's always some information that's going to be left out. So when you're dealing with vertigo, I want to talk a little bit about something called vagus nerve dysfunction. Vagus nerve, if you have vertigo or dizziness and you have other symptoms associated with it, they might be connected. If you have lung involvement, if you have digestive disorders, this might actually be your 10th cranial nerve dysfunctioning. And it can be creating your body to be off balance. The cranial nerve 10, the vagus nerve, is a controller to your parasympathetic nervous system. And that's the part of your system that contributes to the involuntary movements. So all the areas of your body that are dealing with involuntary movements can be affected by this. So if you're having digestive issues, heart rate issues, breathing issues, as well as that dizziness, you need to get this nerve checked out. Because if you treat everything you have problems with and your cause is this nerve dysfunction, you're not going to improve.
Let's talk about some other causes of dizziness and vertigo. And we'll be going through some inner ear disorders, but I think it's probably a good idea to just give an idea of what the inner ear is. So you have your ear, right? The part on the outside of your head that you see. You travel inward in the ear canal, you have something called the middle ear. And then if you travel even further inside of your head, you have something called the inner ear. I mean, that makes sense, right?
Makes total sense.
Okay, thanks. I appreciate that. So the inner ear is also called the labyrinth. And we know what a labyrinth is. It's a maze.
Not from the movie with the little Muppets.
Yes.
The labyrinth.
David Bowie movie.
Yeah, she gets stuck in the maze.
She does. She gets stuck in the labyrinth. So
I fell asleep. Did she get out?
yes. Okay. So the labyrinth is part of the ear that contains the organs for hearing and equilibrium, which is your balance. So it's called the bony labyrinth because it actually has bones in it. It's a cavity, but it has the temporal bone that is divided into 3 sections. I think they're referred to as the hammer, the anvil, and there's one more piece, the stapes. Yeah. So those are the bony labyrinths. And then there's also the vestibule, the semicircular canals, and the cochlea. So all of these that's the definition of the inner ear, right?
Yep.
So let's talk about inner ear disorders.
Yeah. Well, I mean, peripheral vertigo, again, just kind of means you have impaired balance. You're still able to walk, though. Mm-hmm. Then one of the conditions out there is called benign paroxysmal positional vertigo. Easy to say, but it basically is just an inner ear disorder. This one is when you have sudden spinning sensations when you move your head. We've all experienced certain times where you shift too quick and all of a sudden it's like your eyes have to readjust to the area. Well, if this is actually a problem, it can be benign, but sudden movements that cause you to get really dizzy, that's what this really is.
Yeah, the inner ear has the 2 main parts, the cochlea, which is the hearing portion, which is shaped like a snail, and then it has the semicircular canals, which is the balance portion of the inner ear. So the BPPV, when calcium carbonate particles leave the one space and enter the other space where they're not allowed to be, that's what causes the vertigo.
Yeah, our bodies have a lot of do not enter signs on there, and when something enters the wrong place, there's symptoms with it, and the ear canal is no different.
Mm-hmm. And it's like all that has to happen for this to trigger is just tipping your head up and down. I mean, it's something that is so benign that you just might be like, oh my gosh, one day I looked
Getting
up.
out of bed too quickly. People complain about this all the time. It freaks them out, but it usually goes away pretty quickly. There's also something called vestibular neuritis. This is also an inner ear disorder. This one is sudden, severe spinning and dizziness, balance problems. This one generally will make you throw up. It makes you nauseous really bad, and then you want to go and blow chunks. But this one occurs rarely in children, but it can happen in anybody, any age. But this one's usually caused neuritis. Itis means inflammation. So this is inflammation in that cranial nerve that goes to the ear. And so the nerve is supposed to send balance and head position information to your brain. So if it's inflamed, the communication goes bad and you're going to get the dizziness with it.
Yeah, this can take a while to go away, but it usually does resolve on its own when that inflammation goes down. There's also labyrinthitis. I'm up with the labyrinths today. That's my word for the day.
And I still fell asleep during the movie.
So this is also an inner ear disorder, very similar to vestibular neuritis. The only difference is that 2 branches of the nerve are affected rather than just one.
Yeah, and Meniere's disease is probably the most common one that people have heard of that actually has a name to it. The big thing, Meniere's is very common. It's a very common inner ear disorder. This one is major problem if you have it until it stops. This one causes severe spinning sensations, like you want to puke all day long. This one also can cause hearing loss. Your hearing will be affected if you have Meniere's disease, but hearing loss can even happen completely. And ear ringing. So you get that. And we've all know tinnitus is the term for it, but we've all experienced some ringing in the back of our ear, and we're kind of like, what's that? Well, with Meniere's disease, you get that severe spinning with that horrible ringing in the back of your head, as well as hearing loss. Those are the three real clinical signs of Meniere's disease.
Mm-hmm. People get Meniere's, they're like, what the heck? Why do I have Meniere's? There's so many different causes for all of these things. Allergies is a big one for Meniere's, but there are other causes as well.
And that one, fluid. It's a fluid that's supposed to signal your brain to help maintain balance. If you have an imbalance with that fluid, that's what seems to be a big trigger with Meniere's. Mm-hmm. But allergies, immune system, head injury, this can pass on from family. These risks can happen. Genetic risks, migraines, infections.
Yeah.
This one's not a good one to have, and it can last a long time, and it can hit people at any time.
Mm-hmm. Yeah, it's more common in people in their 40s and 50s, but anybody can come down with Meniere's, and there's no cure. We can kind of help some of these things that have caused it, but you're kind of just in for it whenever you get it. So those are our inner ear disorders. Let's talk about, once we start moving outward from the inner ear, let's talk about something called perilymph fistula. So this is just a tear in the membrane that separates the middle ear and the inner ear. So this can feel like that you're underwater feeling of fullness in your ear type of deal. It's when your middle ear is filled with air and your inner ear is filled with fluid. So that's another one of those things where the air and the fluid should not be in those spaces. So that's why it causes, it can cause sudden hearing loss. It can also cause hearing loss that comes and goes, but definitely that dizziness.
And this one, you feel like these are the people that say, God, I feel like there's something in my ear, that pressure that you were saying. They just feel pressure, and it's like they can't even explain it sometimes. They're like, I don't know, it doesn't feel like fluid or anything. It just feels like something's there. Mm-hmm. That can be a fistula. That could be the tear or a defect into that membrane. But the symptoms of this are going to be all the same ones with dizziness. A lot of these have the same symptoms. Dizziness, motion sickness, you'll want to vomit, headaches. The ringing in the ear can happen with this one as well.
And this is typically just one ear at a time, right? It's not like the others where it's just a general dizziness, and it's just one ear at a time because that membrane is affected.
And this is a one, too, that if you have any moments where there's a sudden jerk can cause a major problem. People, when they laugh, if they sneeze or they cough, because there's a tear there, it can hurt. You break a rib when you cough, it hurts to cough. It hurts to sleep. If you tear your shoulder and you have a sudden jerk on your arm, it hurts. So this is no different. If you're coughing, if you sneeze, if you laugh, anything that can affect the ear side, it's going to flare it.
Taking a flight, like taking off and landing, that's going to hurt the fistula for sure.
Oh, yeah. This one does not like flying. That barometric pressure makes a huge problem. There's people that will fly that will literally say that their face feels like it pops. And it's not like right in front of their face. It's more towards the ear side, but it almost feels like instead of like when you pop your ears or you hold your breath and you try to get that balance going, these are people where it feels like their face can pop. And that's
terrible.
Painful. There's nothing you can do for it but get off the plane. Mm-hmm. But frequent ear infections, really loud noises. This can also be people that love concerts and go to concerts all the time. That causes trauma. There's a reason why people get hearing loss when they're around music for a long period of time as well, especially with that noise.
Mm-hmm. There's also superior semicircular canal dehiscence syndrome, SSCDS. That's an opening in the bone that covers the superior semicircular canal of the inner ear. Also, all of the same symptoms, the vertigo, the dizziness, sensitivity to loud noise, fullness and pressure in the ears. It all goes together with this dehiscence syndrome.
This one actually can happen when you're born. So this can be congenital. So if you have hearing issues in your newborn or something like that, this is potentially the cause for that. But headaches, head injuries, infections, nerve issues like MS, tumors, migraines. I know we've talked about these through each of them. All of them can cause dizziness. The idea is what can you do for it? And there's lots of things you can do for it. We just had to figure out the cause.
Every week, I like to give a tip of the week, something that you can do at home to help out your health. And this week, since we're talking about dizziness and vertigo, it's not an easy task to be able to get in the car and go to the doctor and try to get it fixed. So there's something called the half somersault maneuver. There's a PDF online. You can just Google half somersault maneuver and it will walk you through this. This is a lot, and I'll just try to summarize it for you. But it would be best to have somebody read this PDF off to you while you attempt to do the maneuver, because I don't think you'll be able to remember it all or even read it while you're doing it. So you would want to position yourself on the floor. The PDF says or a large bed, but I think the floor is much safer. And so you're just going to try to do a half somersault. So you're going to also tip your head while you're doing these movements. You'll end up looking up at the ceiling, and it might cause a little bit of dizziness as you go through these maneuvers. But then you just stop in between, wait till the dizziness goes away, and then go on to the next movement where you put your head on the floor upside down. It's quite a gymnastics type of movement, but if you do this and then you sit back up as it instructs you to do, because there are certain head movements where you slowly turn your face to the right to face your elbow, try to go, center that, make sure the dizziness goes away, then keep your head turned to the right, and then quickly raise your head to shoulder level. So it's quite the acrobatic movement, for, like I said. But afterward, rest 15 minutes. If you still feel dizzy when you get up, do it again. But hopefully it works for you. I've had patients have a lot of success with this.
Yeah, when they do it right.
That is true.
That's why it's really important that you have somebody help you with when you do anything like this, because if you do it wrong, you could actually cause your dizziness to get worse. Mm-hmm. So it's really important to follow instructions on everything.
Right.
So traditional diagnostic testing, these are pretty common, and naturopathic doctors versus conventional doctors do pretty much the similar stuff too. If they don't do it in their office, they'll refer it to someone to do it. But hearing tests, doing a balance test to making sure you are balanced, to make sure you're hearing things okay. You can run that blood work. Like we said, anemia can be a cause of that. So you would run your CBC to make sure you're not anemic, not low red blood cells. You would run a chem panel to make sure your blood sugar is okay. And you would run the blood sugar tests that go with it. We've talked about diabetes recently, but you would want to check your insulin levels, check your hemoglobin A1C, just to make sure that blood sugar is not part of the trigger for it as well.
Right. And physical exam is really important as well, like doing a neurological physical exam just to make sure that there aren't any obvious neurological symptoms that are showing up there.
Yeah, and if none of those show up, you can always go to the CT scan to see the structures in your neck and in your head. You can do an MRI to make sure there's not a mass. So again, you've got to do your normal checks to make sure that it's not something serious.
Mm-hmm. Yeah, absolutely. So we should probably give some treatments, right?
It's usually a good thing.
Somebody has dizziness, they want to know what to do about it. And obviously, we're going to start with diet because we always bring that up. So you'll want to avoid any inflammatory foods that are causing some inflammation. And we seem to mention it every week. Dairy and gluten, two of people's absolute favorite foods, are going to be inflammatory.
Yes. Now, I say this every week as well. When we discuss both traditional and naturopathic treatment options, we are not giving medical advice. We are giving you information that you can use to discuss with your practitioner for the best options for your health moving forward. So we're going to give you some information about what they do both naturopathically and conventionally. And then you speak to your doctor. And if you don't have one, you can come find a good one at Naturopathic Physicians Group.
Yeah.
But the most common ones that people are going to get are antihistamines. These are over-the-counter. Most common one is going to be Dramamine. Now, Dramamine makes a drowsy one and a non-drowsy one, so depending on what you're doing for the day, choose the right one accordingly. I have done the wrong one before on accident, where I accidentally took the Dramamine, which is diamond hydronate, which is the original one, and that's very drowsy making. Bad sentence. But I probably took it before this. That's why I can't talk anymore. But basically, I was supposed to give a presentation in front of a group of people, and I ate something wrong that day, and I was having a little bit of a stomach thing going on for nausea. And so I decided to take Dramamine, and I took the wrong one. Read labels. I made the mistake. We're all human. And I was like sleeping through this presentation. It made me so tired. I was in and out, and it was just not a good presentation.
Did you get through it?
I had a PowerPoint presentation, but it was not my best presentation. But they do make meclizine, which is less drowsy as well. And so just be careful with that. But these work by helping calm down that nausea and dizziness feeling. And it's the most common go-to.
Mm-hmm. There's also mucus thinners that are commonly given to someone who has, dizziness because there's fluid buildup. So Mucinex is one. We've seen those commercials where that like boogeyman is on there, the Mucinex guy,
the little green blob,
that gooey, yeah, him.
The mucus,
yeah. And Sudafed is also another mucus thinner.
Well, yeah, Sudafed is the decongestant. So what it does is it just clears out that mucus in the sinus cavities there. But that's also the one that they're using to make meth. So do not buy this and make meth. I will say that every time.
Do they keep it locked up like they do the baby formula?
It's not locked. That's a whole nother issue. But what this one is, it's behind the pharmacy counter if you're going to get real Sudafed, which is pseudoephedrine, and you have to give them your driver's license to get it. It's easier to get other drugs easier than it is to get Sudafed because people like to take that and make meth.
Crazy. Okay.
Crazy world.
No meth making.
No meth making.
So if you've been diagnosed with Meniere's disease, there's something called the Epley's maneuver that you can go to a doctor. And basically what they do is they help you do a barrel roll. Your practitioner holds your head in certain angles and positions. So when I was talking about the half somersault maneuver, this is similar, only you have somebody actually helping you, and it's not doing the half somersault by yourself. And this is done in a doctor's office.
Yeah, and there are instructions online how to do that correctly if you are at home and nobody's able to drive you. But again, it is something that you have to do right, or you can cause yourself to get worse. Worst case scenario, if you have vertigo or dizziness, surgery, again, it depends on what's causing it. But they do have some surgical options out there. And of course, if it's caused by a tumor, you got to remove the tumor if possible. If it's caused by blood sugar, you got to regulate your blood sugar. If it's caused by blood pressure, you got to regulate your blood pressure. Mm-hmm. So lots of different things. But medications they use can be used just like meclizine if necessary.
Yeah. Another thing you can do, I talked about diet a little bit before, but when Meniere's disease specifically responds to eliminating caffeine, which is really hard to do, chocolate, also hard, and alcohol and salt also. So if you take these out of your diet at the time you have Meniere's, it may reduce the frequency and the intensity of your symptoms.
And the main thing with salt is because it dehydrates your body, and dehydration is one of the big causes of dizziness and vertigo. Mm-hmm. And hearing impairment, if you have hearing problems, they have great aids now that can make a world of difference if you've got vertigo.
Yeah, absolutely.
But with naturopathic testing, it's really the same thing. That physical exam and all of the other tests that you can do out there, it's not going to be that different between a naturopathic doctor and a conventional doctor when it comes to testing. However, when it comes to treatment, it definitely can be different. Mm-hmm. So we're going to jump right into naturopathic treatments. One of the things we've talked about before when it came to arthritis and pain, we talked about prolotherapy and PRP, which stands for platelet-rich plasma therapy. We have talked about this on a couple shows in the past about how it works to help with arthritis and pain relief. But we said one of the big causes of dizziness and vertigo is structural problems, especially, of course, in the neck. So if you have structural damage in the neck, say weakness due to trauma, accidents, anything leading to your vertigo, you can do these treatments. These treatments basically strengthen up your weak tendons and ligaments, and they can help treat the arthritis that has happened over time as well. So by doing stuff like that, you can strengthen up the structural misalignments. You can strengthen up the damage in your neck, which then can relieve the vertigo, if not make it go away entirely. We also talked about that vagus nerve dysfunction. I've done treatments like this for people that have that vagus nerve. And remember, that nerve dysfunction, if you have the GI issues with it, breathing issues with it, any of those involuntary problems with it, I've treated people with these treatments, the prolotherapy and the PRP, for vagus nerve issues, and it's amazing how much better they get.
I love it. I feel like I'm a PRP junkie. I don't know how I could survive without it. You can also do cervical manipulation or traction. That opens up the nerve roots. And this is another thing I don't think I could survive without. But when you do that traction and those manipulations, it just really opens up the eyes and brightens the eyes. And so if you've got dizziness or vertigo, you can do the same. It acts the same way.
Just think if you're pinching on a nerve, you've got to open up that root. So I do a lot of traction with the prolotherapy and the PRP. So we'll do the traction to open up that nerve so you're no longer pinching on the nerve. Then we do the injection to strengthen up the area so it stops pinching on that nerve. Naturally, the pain gets better, the stiffness gets better, and the vertigo and the dizziness can get better.
Absolutely. You can also do IV infusions of alpha-lipoic acid or phosphatidylcholine. This helps with nerve pain, nerve issues. It's also a really great anti-inflammatory. So as we support the entire body, these IV infusions really get in there fast and work on those nerve issues to help reduce whatever it is that might be causing that dizziness if you can't identify it.
Yeah, we've talked about ALA before, alpha-lipoic acid, like you said. And I don't know if we've talked about PPC. We might have before once or so. But PPC is phosphatidylcholine, as you said earlier. But that's a nerve protector as well. So as you were saying how nerves, if there's damage to the nerves, this can help. But this one's also really great because it also protects your liver. It also helps your body get rid of chemical toxicity. It's also really good for GI health. They've done PPC or phosphatidylcholine for people that have ulcerative colitis with success. So these IVs, the one thing I so love about IVs is they're so multifunctional. It's not just treating your symptom and your condition. It can be treating a lot of other things in your body as well.
Glutathione is another IV infusion that's really great anti-inflammatory, but this also acts as a mucus thinner. And we were talking earlier about the medications that are mucus thinners, but I would much rather a glutathione injection or an IV as my route for mucus thinner.
Yeah, and you can use it by mouth. They are supplements for glutathione. They're not quite as good as doing the IV, not even close for that aspect. But there is also nebulized glutathione where you can have your doctor compound glutathione and you can use it for your breathing treatments because, again, it helps with that upper respiratory and it can help thin out that mucus directly in the lungs. I've used this with people with really bad bronchitis, pneumonias. It's amazing.
It is amazing. It works great. Some of the supplements that you can use if you're having vertigo is electrolytes. Very simple. I mean, we talked about dehydration as an extremely common cause of dizziness and vertigo. You got to drink that water, but add the electrolytes. And especially if you use reverse osmosis water, which I love, but you have to add those electrolytes back in.
You always have to say you love it. I think you do that on purpose.
I do love it. It tastes really great.
It's just because that one time I was negative about it.
Oh, see, I forgot about that.
Oh, I don't believe you for a second.
I did.
There's no way.
I don't lie.
No, I don't hate RO water. It just has to have the nutrients added back in.
Yes, and they have really yummy nutrients also, or electrolytes in powder form that have flavor. If you don't like drinking water and you're tired of hearing us talk about it, we can give you good flavored water to drink.
But don't just go to the store and buy flavored water because most of the flavored waters there are sweetened with sugar or worse, artificial sweeteners, and that's not going to help you. It's just going to make things worse. But one of the big go-tos when it comes to supplements, and it's good for so many different things, we've talked about it on other shows as well, is ginger. It's used for motion sickness. It's used for vertigo, dizziness. It's also so good for your GI health. It just does It's so good. I love it.
I love ginger as well.
And you can find that even Walgreens and CVS, even the drugstores now are carrying ginger as a treatment option for people that have this. And it's even found in the section with the motion sickness stuff.
Oh, how convenient.
Yeah, but it's still generally created by the same companies. They're just saying, we have a natural form now, so we're going to add ginger to the mix, and then they give you like 1,000 milligrams of ginger that you can take, which again, it works. Just read those labels, because
it's probably colors and preservatives and so on and so forth.
I don't know for sure, but knowing the track record, I'd say it's a good possibility.
Yeah, just go get a ginger root at the store and juice it with some apples or something. Also, bromelain is an antihistamine. It reduces inflammation and mast cell production. And we talked earlier about antihistamines can help reduce that fluid buildup that may be causing the dizziness. You can also eat pineapple to get bromelain. You don't have to just go take a supplement, but you probably have to eat a decent amount. But if you feel that fluid buildup coming on, the allergy-like symptoms, then eat the pineapple.
And if you want to pick out a good pineapple, yellow is better than green.
On the outside?
Yes.
Really?
Yes. The yellow means more sweet.
Okay.
Green means not sweet. That's why when you go to the American stores and see pineapple, they're almost always green because they have to pick them so early. But when you go to Hawaii where they taste good, they're always like really vibrant yellow. It's because they can keep them on longer. They get more sweet. The more yellow, the more sweet. The more green, the more bitter and tart.
Cool.
Yeah. So pick a yellow one. You'll thank me in the morning.
Good to know.
For the bromelain and the pineapple.
Right. Vitamin D is another supplement that you can use that may improve positional vertigo, especially if you have low vitamin D status, and you really wouldn't know unless you go get tested, get your blood levels tested. If you get sick often, that's an indication that you have low vitamin D status. But vitamin D also helps with circulation issues too.
If you're human and not taking vitamin D, and not sunbathing every day naked for like 15 minutes, that's probably another good indication that you're low in vitamin D, because it's so common. This is one of the most common nutrient that people are deficient in. You would think we'd get enough of it, but we really do not. And then stinging nettle is a common product that's in a lot of the natural antihistamines. It's also found in some liver supports. It helps with detox, helps with nerves. So again, if it's a nerve issue or a mucus issue, stinging nettle's a really good addition.
Vitamin C as well, good for immune support and also helps relieve dizziness. I mean, vitamin C is just really great in general. I think that it's just something that should be a staple.
We talk about C almost every week because we're talking about immune system and health. But one that not everybody knows about, ginkgo biloba. Ginkgo biloba helps with blood flow. They use this it's a natural treatment they use for ADD, ADHD. It's kind of, on the natural side, it's known as like herbal Ritalin. I think I've even said that before. But basically, it helps with blood flow to the brain. Therefore, if the issue is circulation to the brain causing the vertigo, it can help a lot. They've actually done a 12-week trial using ginkgo biloba daily, and it was actually more effective than antihistamines when treating Meniere's disease.
That's cool.
So this stuff is awesome.
B vitamins also, love B vitamins, but specifically for dizziness, it would be B3, which is niacin, and B5, which is pantothenic acid. And some of the vitamins that we can tell you exactly their mechanism of action and why they work to reduce dizziness. Others, we really don't know the exact reason that they work. We just know in clinical practice or scientific research that evidence shows that they provide relief for dizziness or vertigo, and that would be probiotics, calcium, quercetin, and CoQ10.
Yeah, and remember, when you're treating the body, you're treating the body as a whole. That's what naturopathic doctors do. So a lot of times you get improvement on things you're not even trying just because we're treating the person, and it goes such a long way. So thank you for joining us today on Your Health is Wealth. Next week, we're going to have another great episode of Your Health is Wealth.
Thanks for listening to Your Health is Wealth. Be sure to tune in next week to learn more wisdom on how to live a fuller, richer life. If you have questions about today's show or would like to find out more about the topics we discussed today, call the Naturopathic Physicians Group at 480-451-6161 or email them at info